Over the past 7 years, I've gained so much weight, and losing it has been an uphill battle.
I struggled with my weight from a very young age, from a teenager and a young adult.
I went to a pharmacy and I was prescribed to use estrogen. But I must say the flow was extremely, extremely heavy. Such big lumps, the size of chicken liver.
There's a balance you require to be able to ovulate and menstruate. Those pills are made of all those hormones as well. So they rebalance your hormones, sort of simulating a normal cycle so that you can have withdrawal bleeding.
The problem is not directly carbohydrates, it's the quality of carbohydrates and the quantity. Everything needs to be sustainable. You cannot choose something that you don't see yourself doing for the next 5 years.
Hello and welcome to the Lolo Cynthia Show. My name is Lolo Cynthia. On today's show, we are talking about a health issue that affects 1 in 10 women. I'm talking about the condition called PCOS. This is a condition that has actually led a lot of women to deal with fertility issues, acne, unwanted and excessive hair growth on their face, periods that are irregular and incredibly painful, inability to lose weight, obesity, weight gain, and so many more. So we decided to talk to some women in Africa who are dealing with PCOS, and they shared with us some of their realities. Check it out.
Over the past 7 years, I have gained so much weight, and losing it has been an uphill battle, still is, and to the extent to which that I do not own a full-length mirror.
I struggled with my weight from a very young age, from a teenager and a young adult. Seeking care, just seeking like general care, that's always going to be, the one thing that kind of puts you in like a different bucket, right? So the whole aspect of wellness and holistic health kind of goes out the window when you're, seeking care from the healthcare provider, because the first thing that they're going to say is, well, you're overweight.
People judge me a lot for my size. Eating in public, the people who think you're pregnant.
I started using pumice, that stone that they use to scrub the heel of the feet, the soles of your feet. So I used it to scrub my neck because my mother thought I didn't bathe well because of a dark neck. And it has always been my insecurity. Into my 30s, I started trying to bleach the neck, hoping it would turn lighter.
One of the most severe ones that I experience is a hirsutism. So that's the excessive and unwanted facial hair or hair around the chest area. Which can be a very big cause of insecurity, personally.
I hope that I will be able to gain more courage to own a full-length mirror and take more photos of myself other than my face.
Well, I'm sure you're curious just like me to really understand what PCOS is about. How is it diagnosed? Is it even treatable? Well, we have a gynecologist with us today to shed more light on this. Dr. Abosede Lewu is the Chief Medical Officer of ORB Women's Clinic in Nigeria. She's here to share with us some of the medical implications or medical solutions that are associated with PCOS.
Once you start seeing your period, every month your brain sends signals to your womb and to your eggs. So it sends from signals because the purpose of menstruation is to make sure that you're able to procreate and carry out reproduction. So your brain sends a signal to your ovaries to make one egg, those that have twins, 2 or more eggs or something like that. And then the same brain sends a signal to the lining of your womb and tells it to prepare for a pregnancy. So you see your period every month when you don't achieve fertilization. So that's what girls go through and women. Now, for women that have PCOS, at the beginning of the cycle, when their brain sends the signal to the ovaries, normally it recruits like 10 to 20 eggs, but only one egg survives and it grows. So all the other eggs sort of feed that one egg to make sure it ovulates. For women with PCOS, not one egg matures, multiple eggs start growing together. Now, they don't grow enough to ovulate and they are not too small. So it's like just picture like they have multiple eggs. They have one of the ways to diagnose that they have about 10 eggs growing instead of one. But those eggs don't get to the critical size they need to ovulate. Secondly, those half-grown eggs are the ones that produce those abnormal pattern of hormones that we see in them. It's the one that produces that hormone that makes them have more masculine hormones. Someone that's supposed to have one having 10. And it's the same process that triggers the insulin resistance that leads to hypertension, diabetes, cholesterol problems.
If I have PCOS right now, let's just say I'm listening to this episode and I hear some of the symptoms and I feel like this is some of the things I've also been going through. What should I do? What is the first step? Do I go to the hospital and I ask for tests? What tests exactly?
So you can't request for a test again because it's a diagnosis of exclusion. That's what we call it. Many things can make a woman have irregular period. They are not PCOS. Many things can have a woman have high level of male hormones and not PCOS. The diagnosis of PCOS is based on the criteria where we combine what we find on scan, which shows that the woman has multiple cysts in her ovary, like more eggs than she should have, and features of abnormal ovulation pattern, which usually manifest by abnormal menstrual patterns. So they either see their period for like a long interval. Some of them you see they've not seen their period in 2-3 months, some even a year. And then the last one is features of high levels of masculine hormones. So you see some of them with like hair pattern that is masculine, change in voice. Some have big acne just to show that there's testosterone, and some don't even have it. Like I said, it's lab. Is when you may not see the feature outside, but when we do laboratory tests, we find out that they have a very high level.
Let's talk about medication. Let's talk about treatment. What can women who have PCOS do? What kind of drugs? What can they do from a medical point of view?
How best to treat a woman with PCOS is to find out where the woman is on the spectrum. So I have clients that have PCOS and then you do everything metabolic. They don't have diabetes, they don't have hypertension, they don't have anything. It's just that they have PCOS that is disrupting their symptoms and their menstrual cycle and ovulation. They're not even interested in having children yet. So what they desire at the time is, I want to see my period regularly. Some of them are normal weight. Some of them are already obese because people that have PCOS also struggle to lose weight because of the insulin resistance they have. This is what now triggers all those obesity in them, diabetes in them, all those metabolic components. So a woman with PCOS, the first line of treatment of PCOS is actually dietary modification and weight loss. For a lot of women, it's been found that if they're able to lose 10 to 20% of their weight, some of those metabolic symptoms actually begin to reverse. And when they change how they eat, they know the food that triggers them. So when we manage PCOS, I say, I'm a gynecologist, I can be your lead, but you need a dietitian, you need a nutritionist, some of them fitness instructor, someone that can help you walk that journey. Now, like I said, someone that is trying to regularize their period, I haven't ruled out other things. We can say, okay, you can be on contraceptive pills for a fixed number of times so that your periods gets regularized.
I went to a pharmacy and I was prescribed to use estrogen. But I must say the flow was extremely, extremely heavy. Such big lumps, the size of chicken liver,
Remember that we talked about what happens in the ovaries, how you produce certain hormones, estrogen, progesterone. There's a balance you require to be able to ovulate and menstruate. Those pills are made of all those hormones as well. So they rebalance your hormones, sort of simulating a normal cycle so that you can have withdrawal bleeding. And I like to also chime in here that for women that have PCOS and they don't see their period, one of the benefits of period for a woman is that it reduces a woman's risk of having cancer in future. So what we say that if you have PCOS and they have not seen your period in 90 days, you should see a gynecologist so that they can induce a period in you. So some of them, they don't stay on anything, but they make sure that once in 3 months, they have something, because we have to shed that lining. Once you allow it to stay for long, it begins to grow abnormal cells. We call it atypia, that have the chances of becoming cancer in future. So all these things you give them is to simulate what is happening naturally so that they can see their period and prevent that risk in them. For some of them, we do it so that we can control their fertility so that they can get pregnant. We can say, okay, we've made sure you are seeing your period. Now we can calculate when you're going to ovulate. Now you're going to when you can get pregnant as well.
Our next guest on the show is Lee Kahunde from Uganda, a true PCOS warrior who has struggled with this condition since she was a teenager. She's joining us to share some of her challenges dealing with PCOS as a teenager and how she found the solution that works for her through trial and error. Let's hear her story.
I cut out carbohydrates. It's what they call banting or a keto diet. I was extreme. I started doing weights, and for the first time, my body listened to the things I was doing, because it's not as easy for one with PCOS to lose weight as it is for any other person. There's quite a number of factors there in.
After you gave birth, you said that it feels like pregnancy reverted all the progress that you've made when it comes to PCOS. What happened? Can you share a bit more?
When I got my daughter, I did not know how to protect the gains I had made before conceiving, So what happens, I think postpartum depression and the whole stress of being a new mother weighed down on my cortisol levels. Then I experienced extreme stress. I got a breakout of acne around my jawline. I got a hump, at the back of my neck. My arms became much, much bigger. They've actually just toned down that I started carrying weights again. My stomach looked bloated, like I was pregnant. It was intense. Then I got a moon face, the swelling of the face, inflammation all over the body. And this is all because my hormones, went out of control. And moving forward, I don't know if I have the strength to carry another pregnancy, because going back to my 2019 gains has taken me much longer than it did when I started onset.
Apart from going to the gym now, what else are you using to counter some of the symptoms of PCOS?
I went to a pharmacy and I was prescribed to use estrogen, given that my estrogen levels were very low. And in so doing, my body was able to now balance it out and trigger a period, But I must say the flow was extremely, extremely heavy. Such big lumps, the size of chicken liver, So in itself, it's worrying. It's worrying that you're seeing these big blood clots coming out. But at the same time, you're thankful. Well, at least it's working. At least there's something coming out. Because at the end of the day, you wonder, where does this blood go?
What are some of the benefits that you've gotten? Are you seeing some changes? Are you seeing some improvement with what you're doing right now?
Oh, yes, definitely. I hope I could share some photos. My face, I'll take my glasses off. My face is much clearer. So I had pigmentation, very bad pigmentation. I was dark along the jaw lines with very bad acne breakouts, and that has cleared largely. And my face has shrunk. The moon face is gone. My arms have started reducing. I sleep better. I used to wake up at 2 and fail to get sleep. I sleep better now, and I have lesser mood swings.
Well, we are still discussing lifestyle solutions for women dealing with PCOS. Our next guest is someone that I'm very sure you'll be very interested in. She is a personal trainer and a nutritionist who has a book called PCOS and Me that provides information on supplement, nutrition, and lifestyle changes for women who are dealing with PCOS.
So first of all, one of the big things to note with PCOS is not every woman with PCOS is overweight, right? Not every woman with PCOS is going to gain weight. There are people with PCOS that don't gain weight, but they have every other symptom, right? So that's first one of the biggest things. I can't work out 6 days a week anymore. And it's not because my body can't take it. It's that there's a hormone called your cortisol hormone, right? Which is your stress hormone. And when you have PCOS, it is a much bigger thing than most people realize, right? But the more elevated that hormone is, the more counterproductive every single effort of yours is going to be. So now I do work out 5 times a week, but I don't lift or do like high intensity the entire 5 times.
What is it that women who have PCOS can do when it comes to nutrition? Is carbs the enemy? Are there certain things in their diet that they should look out for that might heighten the symptoms of PCOS? What are some of the advice that you can give for women when it comes to nutrition and managing their PCOS symptoms?
So right now, right, there's currently like research going on that says that fat is not actually your problem. It's the quality of fat that you're consuming, right? Now I'm gonna go like on a limb and extend that and say that this applies to carbohydrates as well. And it applies to women with PCOS. The problem is not directly carbohydrates, it's the quality of carbohydrates and the quantity. What you need to do when it comes to PCOS is understand that everything needs to be sustainable. You cannot choose something that you don't see yourself doing for the next 5 years. That's what I always tell my clients and people that I work with. And I feel like the reason why my approach to PCOS is always so different and why like I tend to get clients who trust me to work with me is the fact that I'm not going to take carbs away from you, right? Depending on who the client is, I would approach it from a place of either cycling her carbohydrates. And cycling basically is if on Monday she has maybe 150 grams of carbohydrates, on Tuesday, she'll probably be sitting at 100, right? And then I would play with that in between and see where she's at and what her body feels like, which is why I always say that if you come to me to work with me as a client, I don't do 1 month. Like I don't have a 1 month program I don't have it because this is real life. And if I say 1 month, I'm going to be a liar because I need to test out a few different things because the plans are so personalized and you need to figure out what works for you as a woman and as an individual who has PCOS.
Well, this brings us to the end of today's discussion. I hope you really enjoyed it. To the women who came on the show today, we want to thank you so much for sharing your story and for giving us expert opinions regarding the issue of PCOS. If you watch today's show and you find yourself in some of these symptoms, please go to the hospital to get diagnosed. I want to thank all the viewers for watching today's show. And I hope that, when we share the last episode, which will be coming very soon, you enjoy it as well. My name is Lolo Cynthia, and I'll see you in the next show. Bye-bye.